you don't know the diagnosis, you won't get the right answer. What's the diagnosis? Type it up, type it up. Come on. So 42-year-old man comes to the office due to hematuria, fatigue, and nasal congestion for the last few weeks. He has no chronic medical condition, high blood pressure, everything, and there's an edema around the ankle, hands, and face. So I'm already started thinking there's a problem with kidney at this point, okay, with edema and stuff. Lab results reveal blood urea nitrogen of 40, definitely kidney problem, because bun creatinine is high. Urine analysis shows moderate proteinuria and large amount of red blood cell and red blood cell cast. Okay, so that confirms either it's a nephritic or nephrotic, but it should be nephritic because of the red blood cell and red blood cell cast. Is that clear, folks? It's nephritic now. Biopsy is performed. Light microscopy reveals cellular proliferation, focal necrosis, crescent formation. See, that gives you the diagnosis. This is crescentic glomerulonephritis. But crescentic glomerulonephritis can be due to Goodpasture or Wegener. Is that clear, folks? Which one is this one? Is this Goodpasture or Wegener? Let's see here. Let me check everybody's answer. So that should be Wegener. High because of your nasal congestion. Nasal is part of your upper respiratory tract. That's the only hint. You should be fighting between these two answers, C and D. If you think it's Goodpasture, go for C. If you think it's Wegener, go for D. What is this? Antineutrophil cytoplasmic antibody. That's C ANCA and P ANCA. Okay, so that's that, folks. You see, very good. If I remove the nasal congestion, you could go for C. Does that make sense, folks? What else can you go also for? If it is basement membrane antibodies, it should be a linear immunofluorescence. And if it is this, it should be granular. Is that clear, folks? That could be a hint too. Actually, in NBA, one of the step one had that question. They said the only way to differentiate linear or granular. Okay. So that's that. Everybody clear, folks? All right. Okay, let's see here. 24-year-old woman comes to the office with the evaluation of joint pain, fatigue, edema, weight gain for the past 4 weeks. She has no previous medical condition except recurrent oral ulcers. Now you see, folks, for SLE, they used to say that mallow rash, right? It used to be the way of explaining. They don't say that. It's too overused. Everybody knows the minute they say mallow rash, it's SLE. But they are bringing in recurrent oral ulcer. Remember, oral ulcer can be due to many things, infection, but those are not recurrent. You get it, you cure. But when it comes to SLE, it comes and goes. That's why it's called recurrent oral ulcer. You should know the minute you see the word recurrent oral ulcer, one of your differential has to be SLE. If you don't, you are in a wrong pathway here, folks, okay? So that also here, it's kind of tells me possible SLE here. Now, blood pressure, okay. Exam shows oral mucosal ulnar, facial puffiness, 3+ peripheral edema, everything here, folks. So we could tell the patient has SLE. When you have SLE, now you have to find out, is it a nephrotic or nephritic? Is that clear, folks? Now, if you keep looking, 24-hour urine protein is 4.5 gram. That's a nephrotic. So that should be membranous nephropathy. Is that clear, folks? When you see membranous nephropathy, that should be this one, folks. Is everybody clear? You see, it looks like a big question, but I like a bigger question because the more information they give, the better to pick it up, folks. Okay, so that's that. That's a nephrotic version of SLE. Everybody clear? Okay.
If it was hi, if it was the nephritic version of SLE, what should I be looking for?
What's a SLE of nephritic? Proliferative, which one is that? What disease?
No, I mean like in a question bank, what should I be looking at?
The protein should be less. There should be RBC Cas, all the nephritic finding. Okay. See this word. You need to write this down next to diabetes mellitus, diabetic nephropathy. Okay, that's how they explain non-enzymatic glycation, folks. It's okay. Go ahead and write that down. Anytime they say homogeneous glassy material in the vessel that's stained pink with pus, that's diabetic nephropathy. Of course, the answer is B here, but at least I want you guys to learn that, folks. Okay, that's how you go for that. Write down the whole thing I highlighted. See, this is a good example. Even though we studied diabetic nephropathy, we didn't cover that. But when you do a question, you probably will get the question right by luck or raw, right? It's okay, either way. But you could learn quickly and add it to the information. See, that's why first aid book and UWorld, you have to use both together. Some information in the first aid is missing in here. Whatever missing, it's not here. The first aid is missing, right? So you have to use both together to learn, folks. All right, so that's your diabetes mellitus, folks, okay?
I have a question here, Dr. Roy. The itching and scratching along a lot and the skin findings can also be like trying to say this patient is losing sensation, lower extremity or something like that?
Yeah, they could give that. Yes, absolutely. Patient can have a sensory loss, cataract, anything. Okay.
Doctor, is amyloidosis also similar, like the pink glassy? That's why I was
no, that's a Congo red stain. No. Okay, don't confuse with that. Okay, so, all right. Get the diagnosis first, then I'll scroll it down. Specific diagnosis. Of course, your eye should scan this. It should help you. Protein 4, everything is negative. No Cas, nothing, right? So that should be a nephrotic syndrome, isn't it, folks? So this is one of the nephrotic. Out of 5 nephrotic syndrome, I thought we only studied one that happens in the kids. Isn't it? All right. This is a minimal change disease. Okay. This is a minimal change disease. 7-year-old boy is brought to the emergency office due to swelling of the hands and feet. 2 weeks ago, the patient was treated for anaphylaxis following a bee sting. During the past 10 days, he has had progressive hand and foot swelling and his feel tighter than usual because edema. The patient urine has become frothy. Examination shows periorbital edema and edemas everywhere, folks, and protein 4. Okay. No blood, no glucose, no ketones, no white blood cell, nothing. Just the hyaline cast, which is a non-specific. We never consider that into anything. So this should tell you minimal change disease. Is everybody clear? So how do I know that? The protein and the age, not much. And also they didn't give any other symptom to consider. Now, pick up the answer if you know it's minimal change. Okay, very good. So normal histology, nothing is there. Only thing you're going to find in this patient, effacement of podocyte, fusion of podocytes. That's it. E is the answer, folks. Okay, fusion. Okay, that should be the answer. Look at that. That's normal. This is the minimal change, how they are losing. Now, all those things. Do you see the podocyte here? They're showing 3, but do you see how it's fused one to the other? That's what that effacement of podocyte fusion, folks. Okay, basically that's what it is. All right, last one. Seven-year-old boy is brought to the office by his mother due to facial puffiness. That is especially noticeable in the morning. And the patient has mild asthma, nothing else is there. Physical exam shows bilateral lower extremity pairing edema, nephrotic range of proteinuria. Now, when you look at this, okay, consistent mainly albumin. That's a giveaway here. It's a selective albuminuria in a kid. Minimal change disease, increased filtration of plasma protein, folks, okay? There's nothing here. It comes the right way, folks, okay? Not A, impaired tubular reabsorption. That's Fanconi syndrome, okay? That's A, folks, okay? Not any of these things. So that's minimal change disease. You see, same explanation, same picture. If you would have done this question and you read all these explanations, there is no way you can miss this question because they pretty much cover everything. Is everybody clear, folks? Okay, that's why UWorld has 4,000 questions, but technically it's only 1,800 concept, but they have multiple questions in the same explanation, folks, okay? All right, good.